right, going live for the first time, have no idea what I'm doing. Trying to add Robert Gardner here to have a discussion. All right, just sent an invite to him. Let's see if this works out. Hopefully it'll work. Technology is always a blessing and a curse here. So trying to go live on Massage Entrepreneurs here. Although I don't think I'm not in the group right now. All right, it says it's adding Robert. Cool.
Hey, Tim.
I need to go into the group, right?
No.
Okay.
So is this just from your personal feed?
Yeah, I just went on Facebook, pressed go live.
Okay, but you're not doing it within Massage Entrepreneurs.
Right. So
Okay, yeah, no, that's fine. That's fine.
Okay.
So let me change my camera stance here on my tripod, and then we can get this set up. Ooh. But yeah, see, it worked from here. I'm not sure why the other was giving us problems.
Yeah, I don't know. Pretty frustrating.
It happens.
Yeah.
So on my end, it looks like there's a light like right behind your head. Is there any way we could change that? It's a little hard for me to see you.
Yeah, for sure. Is that any better?
Yeah, that looks better to me.
Sweet.
Let's see if I can get my phone propped. I'm not using a great tripod for this, but I think this will work.
Cool.
So, listen, I'm sorry we had like tech difficulties initially, but I wanted to be able to have this conversation with you and talk about, it sounded like skepticism, pain science, and what was the other category?
I'm talking like bodywork modalities.
Yeah. So those are all like keen concepts that I talk with students about. Not so much clients. Clients aren't as concerned about it.
Right.
So long as I can help them, they don't really care what I call it.
Right. Exactly.
Yeah.
But yeah, I have found that interesting working in like franchise kind of settings. People are like, what kind of massage is this? Like, what kind of body work are you doing? What do you call it? And I'm just like, I don't even know. Like, it's just my blend of everything I've studied up until this point.
Yeah. How long have you been working?
About 6 years. So not like super long, but I started off in franchise retail body work. So
Yeah.
I just feel like I really hit the ground running and gained a lot of experience really fast. Just, person after person coming in. So
Yeah.
that was a great experience.
Yeah, it's a lot of people to work on. I mean, 6 years is seasoned to me. I think sometimes like anywhere from 3 to 5 years is what it takes to get somebody, I think, firmly footed in what we do. I think it takes time to build muscle memory and practice working with clients and kind of start to find your own voice
For sure.
in the community. But what do you want to talk about first?
I mean, we can start with kind of modality stuff. So like within the group, I just see a lot of people, especially newer people to body work. They're asking like, what modalities should I study? Where should what should I look into? And I just feel like a lot of people are kind of hung up on that idea of finding like the perfect modality and the perfect techniques. And I think our focus should be more on humility and client engagement and empathy for our clients, listening to their story and what's going on, and utilizing whatever techniques that we feel most confident in, and our clients respond best to.
It's a hard discussion for me to have with some people in the massage community because there seems to be like a divide between people who maybe like you and I, maybe we have a better understanding of the philosophical implications of what a modality is. And then other people who are like, what's the big deal? It's just doing a different kind of work. It doesn't,
Right.
people just want help. It's another set of tools. But I get to a point where there's a sort of limitation. And, with me, for years I did Thai massage, and I was teaching Thai massage, and I was selling Thai massage materials, only to bump into the traditional Thai massage community that said, what you do isn't theoretically Thai, and it's not culturally Thai, so it's not Thai.
Right. Yeah.
And I went, wait, what? I don't even think of Thai massage as being a modality. Thai massage is just a particular kind of like mat-based body work that, essentially people in the traditional Thai massage community are arguing about the theory. Like if you take this master and this master, they'll, butt heads like kung fu guys and say that, this guy's magic energy lines are better than this guy's magic energy lines.
Yeah, totally.
And that wasn't really what I was teaching to begin with. I was giving them send lines to get started, but it was like anytime I did a demo, what I heard was, oh, you're doing myofascial release. Oh, you're doing trigger point therapy.
Right.
Oh, this is myoskeletal alignment. And I'm like, I thought it was Thai massage. And much like yourself, I just blended.
Right.
Because how do you explain your 6 years experience and what you've done?
Yeah, I mean, in massage school, I went to a school that had an emphasis on myofascial release, and they really held on this pedestal of structural integration. And I already knew going into massage school that my approach wanted to be beyond just relaxation kind of spa work, and I wanted to do more like therapeutic work. So I really vibed with what my teachers were putting out, and then I held Rolfing on a pedestal. And so that was like my goal for a while, to study structural integration and Rolfing work. But what I've come to realize through all my studies is that it's all kind of a means to an end. We're just working with the nervous system. Like tissue plasticity isn't really a thing in short-term situations, and including manual therapy. We're not really, we're not changing tissue. We're not changing structure. We're interacting with the nervous system.
Yeah.
So again, like whatever you feel confident and comfortable doing, and however your clients respond best, that's what's gonna, help you out.
In class, I walk the students along, and there's a send line that runs down the inside of the forearm, and the students want to know what tools to use to work it and how much pressure to use. And I go, how does the client feel?
Exactly.
How does it feel? How does it feel, guys? Like your client and their feeling determines the tool you use, how much pressure you use. Yeah.
Exactly. So what's resourceful, what's useful for the client, to shift their perception of how they're feeling in their body, because that's what we're doing. We're shifting people's perception of their comfort, their pain, their ease within their body. And so we can have these great experiences of people getting off the client and looking and feeling different, and then we can associate that with like, oh, this specific modality, this specific technique, that's what worked, and that's how we got those results. But really, we're just altering people's perception. And so that may look like they're standing taller, or they have better, more full dynamic breath, but really we've just got them to chill out and feel different within their body.
Yeah. It's like I have these conversations, and it's funny to me to talk with you and to talk with Walt Fritz, to talk with Jason Erickson, other people in the pain science community generally, and then to feel like this outlier that came from this other kind of tradition, into this other piece. And I never really lied, if that makes sense, or told stories or made up answers. I would just tell students, listen, the basics of it as I understand it, to be very, very simple, is we provide a stimulus and their nervous system responds. That's
right.
all.
Yeah. Just providing the right input and the right novel stimulus.
Yeah. But the thing is, like the students, like if they're taking a class with me, even a beginning class, they want to work on something, and let's say the person has elbow pain. And they want to figure out, do they use a compression? Do they use a stretch? Do they use a mobilization? Do they use skin traction? Do they use, and I go, I don't know. How does a client respond? And they're like, but we want you to teach us a 10-step formula.
Right.
And I'm like, no, because you're going to deal with a client that doesn't respond to the 10-step formula, and then what do?
Right, yeah.
It's like teaching them scales, sure. Teach them, here's some tools, but in the end, I have to communicate with the client and learn to improvise.
For sure, yeah. And then, yeah, to add to that, like another thing I see within the pain science community is this emphasis on working lighter. But I actually don't always work very light. So I'm really into DNM, dermoneuromodulation, which I think is a really great framework for how manual therapy works. And a lot of people think that's like a modality, but it's not so much a modality or a technique. It's more of a framework for explaining how we get the outcomes, the results that we do. But a lot of people work very light, skin stretching kind of stuff with that. But sometimes people need like a forearm. Sometimes that's useful for them, and I'm willing to provide that still.
Yeah. I mean, I stretch skin, and sometimes I do that by standing on people. It's not painful. I had a distinct notion when I had a conversation with Walt Fritz recently when we were talking, and I talked about like standing on people. He had this moment of like, ooh, it's a lot of, compressive force. And I would talk about compression, and I noticed this. I think compression, when I was using it, compression to me didn't mean pounds per square inch. Compression meant I was using a bigger, broader structure like my foot to work on a larger surface area. And I'm having an effect on a larger area using like a double-footed compression.
Right.
It wasn't about the depth. It wasn't about the pounds per square inch. It was about making contact.
Right.
But I was having to think about that and how do I refine my language to represent what it is I'm doing.
Right.
And Ben Brown was asking, if you change the person's perception, does it in fact change their reality and the function of their body?
Yeah, I would say, we have people get off the table and they move better. They move differently. They breathe differently because their perception has been shifted. They feel like there's more space between their ribs. They feel like their diaphragm is more expansive. And it's all because we've shifted their perception of how they can feel in their body. We're opening up new possibilities of how they can feel that they weren't aware of. So it's increasing awareness of their body. And so again, like whatever is resourceful. So if a forearm that's kind of heavier is going to get someone more in their body and feeling their body differently in a more resourceful way, then I'm willing to utilize that as long as they're not contracting, because we're trying to bring more ease to the body. So we obviously don't want people to contract away from our work. So yeah, whatever's useful, if it helps them get into their body more, as long as it's not contributing more to their pain, because we can train the brain to be more into pain. Like we can work those neural pathways and teach the brain like, this is painful, let's not go there.
Ben, when you say that modalities are not as important as intention, I think that I would generally agree with that. The way that I see modalities being used, and Tim, you can give me feedback on this, the way I see modalities being used in the massage industry currently is they're looking for this magic box, this magic system that gives them what they need to work on people. So myofascial release, trigger point therapy, Rolfing, all this stuff becomes like another, box that has the answer. Also, modality becomes like a tack-on service. So what modalities do you add to your massage? They've gotten their license, to do massage. Now they're adding a tack-on service like craniosacral therapy or trigger point or whatever. And when I work with students, I always told them, I'm like, listen, I do prefer working on a mat. because I like using my legs and feet. I like having more tools, not less. All I'm really doing is making you aware of the fact that you have a wall full of tools, and when the person comes in, you're going to be able to use whatever tool you think fits that day, that session, that client, that issue. I'm not trying to limit your tools. Like if you want to work on a table, I'm not going to tell you that's bad work. I just want you to understand that from my perspective, having a mat-based practice, using my legs and feet, I have more tools available. Modalities itself, it's like they get into a very confined, increasingly small box if they want to grow. Because what if they've gotten used to craniosacral therapy? What if they've gotten used to only delivering a dime's worth of pressure? And then all of a sudden they get to the end. Like they can't extract any more out of this for whatever reason.
Right.
How do they move into deep tissue, whatever that is, or MFR, or neuromuscular, or neurokinetic therapy, or all this other stuff? That's what my concern is I don't want to limit therapists to a certain set of tools, and that modality thinking, I think, encourages that.
Right, yeah. And it almost seems like the more like mystical or metaphysical or more obscure the modality is, the more some people are attracted to it. They're like, whoa, no one knows about this. It must be like on this other level or something. Yeah. And what I've found is, don't get caught up in modalities. If you're trying to help people in a therapeutic context, you're trying to help people with pain, learn more about pain, learn more about biology, learn more about the brain, and learn more about psychology and behavior of humans, and apply that to your work. Apply more principles rather than techniques.
Yeah. I mean, I think it's all part of a growth process. It gets to a point where I don't spend a lot of time, how do I put this, attacking modalities. It's just, I think that it becomes a dead end at a certain point. One of the reasons I chose to rebrand, because again, people were saying I wasn't teaching Thai massage. And I'm like, well, if I'm not teaching Thai massage, what is it? Like, we could still call it massage and body work, but that didn't really define what I was doing and why it was different. The reason I chose the name Reboot is within that brand, there was this kernel of we're going to continue to change it and continue to allow it to evolve. So as pain science grows and develops, we add more.
Right.
As my knowledge base, includes other stuff from working with physical therapists or doctors, it means that I can add that pain science information into the practice.
Right, yeah. And I worry how much body work is actually evolving. Like, I feel like we're kind of stuck in our own little corner of like the healthcare field. We're stuck on modalities, techniques, and we're saying like, PTs or chiropractors or conventional doctors don't have the answers and we do. And we tend to isolate ourselves. And I feel like there needs to be more humbleness and humility.
Sure. The challenge that I see when it comes to what you said about doctors and PTs, doctors and physical therapists, in my experience, are not trained in the sort of soft tissue manipulation that you and I deal with on a daily basis. They just don't. And they're not going to spend an hour with a client working through tissue and going, ooh, wait, what's this along your ulna right here? They're just simply not going to do that. It's cost prohibitive for them to even try to provide that manual therapy service, which is what we provide.
Right.
I have lots of critiques and criticism of the Western medical establishment, including insurance, that could go on forever. That's a total interview. But I don't feel like I'm in a situation to go and talk with network physical therapist doctors, because they look at me and it's like the Big Lebowski from, the film just wandered in the tumbling tumbleweed. And they're like, who are you? You're some hippie. Listen, you don't know anything. That's kind of the attitude they take. But I've been helping people in chronic pain for over 15 years and have continued to push those edges till I'm doing work that doesn't even look like massage anymore. I have just as much massage training as I do yoga. And here's what happens. When I talk about what I'm doing, the massage community is confused and feels like it's yoga. And when I talk to the yoga community, they're confused and feel like what I do is massage because I had fused these disciplines in a different way. Make sense?
Right. Yeah, totally.
Yeah. Yeah. And it's like in the end, it's not like, this is right or this is wrong or vice versa. Fundamentally, I was still working on people.
Right.
And working on people means you're working with the same anatomy, physiology, and biology.
Right. Yeah. Yeah, and I think we tend to forget that we're working with a human that has a brain, that has fears, hopes, dreams, has a past that could include trauma, all sorts of injuries that are not just affecting them physically, but emotionally too. And it's keeping them from enjoying and being fulfilled in life. But we just see this meat suit in front of us. We just see muscles and tissue and bones. But yeah, we
see that reductionist thing. I was a philosophy student before I became a body worker, so some of this stuff feels like second nature to me. And I remember the first presentation I ever gave at a school, there was a school owner, and then on the wall you have all your anatomy charts, and it was like the muscular system, the skeletal system, the nervous system. And I'm like, listen guys, you're here in school and they're taking you and they're reducing you. They're reducing you. You're an organism made of organ systems, made of organs, made of tissues, made of cells, made of atoms. They're reducing you. Nervous system, skeletal system. I'm like, no, that guy right there, he's a person.
Right. Yeah, exactly.
When you press on this, you're pressing on a person with
Right.
those hopes and dreams.
Right.
And the thing is, being able to reduce is important. It's an important factor in science and being able to refine and test, double-blind studies. But in the end, we have to realize that we do work on people.
Right. Yeah. And our sensory nerves, they run directly out into our skin. So when you think about it, like we're really touching the brain through the skin. And then also to your point, how much time we spend with our clients as well. Like you said, like PTs, they have this very limited time. They might only spend 30 minutes with them. A normal, like a conventional doctor, they're in and out really quick. So you got to think like maybe our outcomes are positive because we're spending so much time and care. We're in this intimate setting with clients and we're feeling into everything and asking them questions about how it feels for them. No other field really does that as much as us.
No, yeah, it's just not. The thing is, I understand people in the pain science community from massage specifically, or at least that's my dealings, that's what I have, is we know that we spend more time. One of the things that happened for me, my practice in private practice the last 2-3 years or so became a backlash to what I experienced working within the medical system, working for a chiropractor's office. And what happened was you had 30 minutes or an hour. It was like a drive-through after a while.
Right.
And I was the mechanic. The other therapist and the chiropractor referred people specifically to me. Anybody who came in and had more than a session and didn't quite improve, they're like, go work with Robert. We don't even know what he does anymore. Like he's good at helping people, but we don't know what he's doing. So I could work on those people, but every time I had like a 30-minute session, I realized I felt like I could help them more if there was just more time.
Right.
And what it felt like was every time you went to work, you were putting a Band-Aid on a tumor. You never had a chance to really do what was needed. My practice, initially it was like 2-hour sessions, and then I bumped it to 3 hours. My 3-hour reboot is now my standard session. And a lot of people, massage therapists are like, dude, that's crazy. Like nobody, that's just, and I'm like, listen, if I can get clients to sign up for it, and they do, and I get really good medical grade results from the work and for people who are in chronic pain. And here's the thing, if you had to choose as a massage therapist, would you want to receive a 3-hour session? And they're like, well, sure. Okay. Would you want to give a session that was 3 hours? And they go, well, what I looked at it was like, listen, there's drive-through And it's not to diminish fast food in any way. There's drive-through experience, and then there's a 5-course French meal. I decided to go towards the 5-course French meal. I wanted to produce body work, not only the body work itself, but also the setting, the accoutrements, the way the session was structured to make it stand out, to make it be a complete sore thumb in the industry. It's like, did I think I could help chronic pain more in 30 minutes or 3 hours? And I was like, I think I can do it in 3 hours. I would prefer that. So that's what I chose to do.
Yeah.
And then you wound up with a form of work that no facility in America would hire you to do.
Yeah, for sure. Yeah. And I also see a lot of people within the group asking or talking about how they're uncomfortable in their own bodies and like how to deal with their own pain. So again, it goes to how you choose to work, not getting caught up in you have to work this specific way. Like find a way that's comfortable to work within your own body.
Clients have been trained by the industry to want extremely deep pressure, and they've been trained as therapists to deliver it through this.
Right.
This is just not designed as a structure to take that much compressive force.
Yeah. But yeah, I mean, I know I've gotten really passionate in the group and I probably turned people off from it, but I'm just really passionate about it because of my own experiences with myself in my own family. Like I had really debilitating sciatica symptoms like in my early 20s. I went through PT and they didn't really care. I was just, a body in there, and they pretty much had these prescribed things like, oh, you have these symptoms, do these exercises. And they kind of like stood in the corner, like the PTs and the PT assistants, to like sipping coffee, talking about their weekend plans. And I didn't feel heard or seen. And so I took it into my own hands. I was like, screw this, I'm out of here. They basically had me doing like core exercises and like Pilates and yoga. And I was like, I'm just going to go do this myself. You guys aren't really helpful and you don't really seem to care. And then my mother had severe chronic pain, fibromyalgia, and rheumatoid arthritis. And for a long time, she went to all these specialists. They couldn't find out what was going on. And they're like, it's all up in your head. It's all, we don't know how to help you. You're going crazy or something. And she literally started to feel that and take that on and started losing her sense of self and her sense of identity, and just spiraled downward into deep depression. And it was painful to see that. So I just feel like it's really important that we see our clients with more humility and see them as humans walking in and listen to their story.
Yeah, there was a chiropractor I worked for years ago, and it was really a breaking point for me. I was so happy to have moved to Texas and to be able to work in a medical establishment because I was hoping to be able to learn more to kind of add and supplement, my understanding of what I was working on. And a woman came in and she spoke very broken English, and it was about her neck, and she just kept saying, paining, oh, neck paining. And the chiropractor pulled me aside later and said, listen, that lady's crazy. He's like, there's nothing wrong with her. And I said, oh, well, she says she's in pain. And he's like, no, I've looked at her x-rays. She has a tiny bulge at like C6, C7. You and I probably have more pain than she does. And I said, she says she's in pain. There is no test for pain. There's asking the person how they feel.
Right,
there is no test. There is no plug her in. Okay, this is the level. Like, listen, all of her pain could be emotional and psychological. I don't know. But it's still pain. It's still pain. Like, it doesn't matter that you can't see it on a scan. That's not how that works, Mr. Chiropractor DC, sir.
Yeah, emotions, stress, trauma, it's not going to show up on an MRI or on an X-ray.
Or, if, and I see this all the time, because we are soft tissue specialists, somebody will have a tight muscle in their neck. I can feel around tissue and go, ooh, wait, what's this right here? And they go, ooh, it's so tight, tender. You work on that for 5 or 10 minutes and it changes their whole life.
Right. Yeah.
Their perception of that pain completely goes away. They think you're a miracle worker, and you and I both know all we did was provide an interesting stimulus.
Right. Exactly. And then on the flip side, with like MRIs and scans, imaging, and so forth, people can have like herniations. They can have these biomechanical abnormities, but they don't always correlate to pain. So someone could come in, they say they're in pain, they have this abnormal, like something not normal on their scan, and it's like, well, how long was that there? Have you always had pain? You don't know when that happened.
Yeah.
And it's just normal degeneration. It's fine. It's kind of like wrinkles on the inside. As one of my teachers, Michael Pollan, said, I think he got that from someone else, but I really like that. And there's a lot of elite professional athletes who have abnormal scans and they are asymptomatic. So it's something to consider. Stress and our perception and our meaning of what's going on in our life is so much more valuable. Like technology hasn't really caught up yet. We don't really know exactly what these scans, what the imaging means.
As somebody, again, it was like I was teaching Thai massage, and people were saying, this isn't based on science. And I went, it's based on clinical experience. Like, it's not any different. Like, I'm manipulating soft tissue. Like, I was never operating on some magical line theory of what was going on. It was like even the story of that, it's like people in Thailand were trying to make sense, 1,000 years ago of like how bodies worked.
Right.
They just didn't have the same science. But here's the thing. If you take the same stuff biomechanically and you add pain science, what is that? And they're like, oh, that's not tradition. And I'm like, I'm not interested in tradition. Tradition is when we took, George Washington and doctors did bloodletting and he died. It's like our science has gotten better now.
Right. Yeah.
Our medical care is improved. Like people use the best that they had, but how does it continue to evolve? And that's really what I was, most interested in. Like I spent some time at the Esalen Institute, and I find it really interesting because for me, the Esalen Institute was just like, yeah, of course we're looking at where English hits history, hits anthropology, hits psychology, hits emotions, hits reason, hits logic, hits dance.
Right.
But it was this countercultural facility, which is also where Ida Rolf kind of got her start.
Right.
And it was like, sure. I mean, you and I both know, have you ever had a client sort of like have an emotional breakdown after you work on them?
Oh, for sure. Yeah.
Yeah. And the thing is, it's like, I'm always there to provide, I think, of nurturing, support to clients. But sometimes they have this response like, I don't understand how you work on my body, and I have like an emotional response. And it's like, bodies are really complex. I just watched a film called The Empire of Scent, and it was all about how scent is processed in a very similar area to the brain as like the amygdala, which is in partial control of like our fight or flight response. So it's like scent triggers this memory of like my grandma when I was a kid. It's like the smell of blackberry cobbler. And it's not rational. It's not something I think about. It triggers this almost like sadness where you remember your grandma. It's that same sort of thing that happens with touch and trying to understand touch and the parameters it has for people's sense of well-being, health, and then pain reduction.
Right, yeah. And our brains aren't always completely rational. Our brain is just trying to process our environment and what's going on and just trying to make the best meaning it can based on our past, based on our experiences and our current awareness and knowledge of the world. Where was I going to go with that? I don't know. But
So Brenda was asking about like reading a client, you know, and whether that was part of pain science. And I feel like pain science and the thing is, I feel like I'm very much just scratching the surface, by the way. I don't feel like an expert to speak on it. But the thing is, one of the things that made me feel more comfortable talking about pain science was interviews and conversations I'd had with Walt Fritz. And Walt would pull me aside and say, listen, pain science in no way, shape, or form is necessarily changing how you interact with clients. It's changing why you think it works to begin with. It's talking about the fundamentals of like what's happening when you deliver soft tissue therapy.
well, I'd say it is changing how we interact with clients, like the language that we bring when working
Sure.
with clients. But I think what you
But as it changed, the body work was
right,
a little bit more of what he was saying.
right,
Yeah.
right, yeah, yeah,
Because I think a lot of therapists think, again, they think DNM, dermoneuromodulating, they think it's a modality.
right, yeah, and it's not a modality. It's more of a framework for how this works. And I just think it's extremely valuable to always be questioning how we get the outcomes, the results that we do, and how it works. But yeah, like when I first started digging into this stuff, like I thought what I did was pointless, useless. I didn't understand why I was doing it anymore. I was going to give up on body work. And it was really challenging at first. I thought everything I was doing was wrong. You don't need to change your techniques. It's more questioning why we get the results we do, how we interact with our clients from language, and the answers that we give to clients if they ask questions. It's perfectly fine to say, I don't know. I feel like we always feel like we need to have the best answer. Like, why does this hurt? Oh, it's because you don't have enough Taller Glide or something. It's like, we don't know that for sure. Like, so yeah, it's just being humble, asking more questions, not being locked into rigidity. But yeah, your techniques don't need to change. But I've been a lot more careful around language. Language is just so powerful. That our language has opportunity to hurt or be helpful.
Yeah.
So even if someone is like, "Oh, doesn't that feel really tight to you?" It's like, I don't know. Like, I have to question my own palpation skills. I don't know, based on what, like,
Yeah.
especially if it's a client I've never worked with before. I have nothing else to compare it to. I haven't felt you at ease before and then in tension now. So just asking them, bringing it back to them, how do you feel? What does it feel like to you?
Yeah, there's so many options. If I'm going through and feeling somebody's neck and I go, oh, hey, what's this over here? I don't even remember the last time I say, oh, this feels tight to me. But I will say sometimes this feels more dense. And dense is kind of neutral.
Yeah.
Dense doesn't, it doesn't have like an emotional tone. Walt will often talk about like trigger points. The therapist tells them, oh, you have the worst trigger points I've ever seen. Now the person takes on this sort of weight of like having this horrible whatever they are.
Yeah, now they're broken, they're damaged, they have all these trigger points, they don't know what to do about it. And then it just like spirals and like I find that people that care more, then they're going to go home and research, and then they want to get like trigger point tools for themselves and foam rollers, and to me it's just like chaotic. It's just a mess. And I've been down there too. Like I had all these like self myofascial release tools and was doing all this weird shit on myself all the time, and it's like you just have to.
Yeah, I have a trigger point series of videos that I started producing. Oh man, this has been 6 years ago probably. And even the concept of trigger points, like I wasn't digging into the science of what a trigger point is. I just knew that on some people they'd have hand or wrist pain, and you could show them how to work on their forearm extensors, and it would relieve some of that discomfort. So I would show people how to use a tennis ball or other tools to work on themselves. And I would get fairly positive feedback about these YouTube videos because you were empowering people to work on themselves. They didn't just have to come to us for another session to be able to get relief.
Right.
And it was providing them a way of doing maintenance. So I started producing those videos because I realized at the chiropractor's office I only had 30 minutes. I didn't have time to walk them on through self-care. But if I made the video, I could give them a business card and write down the name of the video so they could go find it and work on themselves.
Right, I dig that.
So it created this, social media marketing, self-care sort of, package. What I was most blown away by, though, is when the clients were leaving and I said, hey, I wrote down, the name of the video or whatever you can search for to find me. Go ahead and watch this video. They would leave higher tips and say, I've never had a massage therapist educate me before. And all I could think was, wow, that sums up what's actually going on in the industry.
Yeah, totally.
Like, I've dealt with students at a school and the guy will say, listen, I don't know if this is good for business. If you show people how to work on themselves, they won't come see us.
Right.
And I think they've got it totally backwards. I think if you, Tim, make videos, put them on YouTube, talk about pain science, dermoneuromodulating, show people skin stretch, show people how to work on their friends, family, loved ones themselves, it creates more business, not less.
For sure.
The public has no idea what massage therapists do.
Right. Yeah, and I'm working on making more public videos, but oftentimes I make private videos for my clients specific to what exactly is going on with them. So self-care and resources for them. So at the end of the day, I'll go back and just shoot a quick video and throw it up on YouTube unlisted and just send them the link. And then they have a custom video so that they know, so that they have some tools and resources to help themselves. So I might be kind of a minority in this, but like I kind of want to put myself out of business. Like I don't want clients to rely on me. I want to empower them. Like we're all resilient and adaptable, and you have the inherent ability to modulate yourself.
Yeah, there is an opiate epidemic in the United States. There is no shortage of people to work on. There is absolutely no shortage. And the thing is, when we say, chronic pain, I'm just talking about, the guy who works at a desk 60 hours a week and he has a nagging 2 to 3 out of 10 on a pain scale where he's like, man, God, right in here, ow. It's just annoying.
Right.
It doesn't cause his whole life to turn upside down. He's not abusing opiate medications. He's just annoyed. It's like usually we can, in a fairly short hour session, be able to help someone with that. And if we can supplement and show them how to work on themselves, what I think happens is you help him out of pain, you get him into maintenance, but guess who he talks about?
Exactly.
And he says all his friends and family, he's like, man, it was awesome. I've never had anybody work with me like that before, but it really helped. You should go see him.
Right.
Referrals.
Yeah, totally.
So what's up with Rolfing? I wanted to talk about that specifically since you've had a little more background or experience training with it.
So it's a system of the classic thing is the 10 series. So you take a client through a 10 session series. Each session focuses on different holdings or different areas of the body. You work methodically throughout the body. And it's about organizing the body along their central line of gravity. It's working with posture, with movement, education. And so there's like an old classic narrative of, you fix their posture and then magically when they're aligned through this work that they're going to be pain-free. But we've come to find out that that doesn't really hold true. So posture doesn't necessarily correlate to pain. Posture is important for performance and when we're under load. But like day-to-day life, there's no perfect one posture or optimal posture. The best posture is the next posture. We just need more dynamic movement in our lives. We're just not moving enough, I feel like. And we've kind of disassociated ourselves from our bodies. But so I'm starting to spin off now, but But there is value in Rolfing because it looks more at the whole human, their whole experience, and it goes more into the psychosocial factors. And it's asking pretty prominent questions like, what is it like to be in your body? What is it like? What does it feel like to live within your body? So that aspect I really appreciate about Rolfing, and it's looking how they move and interact with their environments, which I still think is extremely valuable and important. And finding resources for clients, finding new ways for them to move that are maybe they're not more optimal. Like, again, there's no like bad or good movements. It's just finding new novel movements that might make you feel more comfortable in your body because you've never moved that way before. So it's like offering suggestions like, why don't you try posturing yourself this different way, or why don't you try doing that activity this way instead? So I find a lot of value in that.
Yeah, lots of different pieces. I wasn't sure whether you were like certified as a Rolfer or not, or whether you'd gone through some training for to just receive sessions and knew a bit more about it.
Right, yeah. I've been certified through the Rolf Institute in Boulder, Colorado.
Oh, okay, yeah. Are you still practicing? Like, in other words, in your practice, are you doing Rolfing or doing what you call structural integration, or?
I don't really call it that anymore at this point, but I do. It does kind of look like Rolfing.
Yeah.
But it's traditionally like it's pretty heavy-handed, and that's what a lot of people think. But again, like whatever is resourceful for my client is what I'm going to use. I'm not going to drive my elbow through them if they're contracting and they're in pain. It's just not necessary. But yeah, I still, do movement education. I do posture education, and I don't see it as like I'm trying to fix their posture or that there's one posture that's better than another, but more so just offering it. When you alter someone's posture, it might bring about a new awareness of how they live in their body and how they feel. So I do work with that, and I do bench work as well, which I find helpful so that people find more support underneath them. I'm still pretty biased towards that. Like, I feel like the more mobile, adaptable, and supple our feet are, and the more kind of grounding and support we feel underneath of us, then we're going to feel better in our body.
Yeah.
And not just like physically, but emotionally too. It's like centering yourself.
There's so much to it. I started to compare it recently to like music or food or painting. In the end, we pause for just a second.
Yeah.
That was weird. I never had to do that before. Anyway, I think of it as like painting. It's like Picasso is known for his blue period, but he had like a 30-year-long career. And the thing is, you just simply, all the painter is a guy and puts it on a canvas.
Exactly.
But how you do it, the colors you choose, the shapes you make, the muscle memory you build, completely changes it. And I find the same thing happens with body work. It gets inordinately complex because students sometimes they want to know, like, well, why do I do this or why do I do that? And sometimes I just go, guys, based on my training, what teacher shared with me and what I've personally felt, I find this seems to work. I don't know why.
Right. And it's fine to not know why.
The challenge is to get your easel, get your paints, and go paint every day.
Right. Yeah, exactly.
And then do it again and again and again and again and again and refine it.
Yeah, totally.
Yeah.
That's awesome.
So see, we talked a little bit about modalities. We talked a little bit about like skepticism and pain science, and then a little bit about Rolfing, which I thought were the topics that we, primarily discuss in this conversation. Do you have any other like specific issues that like come up for you that you really want to talk about, you think are important?
Not really. I think we covered things pretty well. I mean, coming from the massage entrepreneur group, I think adopting this kind of more psychosocial model and having more awareness around that is from a marketing standpoint is going to be helpful too. Not only how we actually work and interact with our clients, but even from a marketing standpoint, it's like I care more about you and your experience and your story more than I do about what latest modality I've learned or what techniques I've utilized. So it's putting more focus on the client, which is going to have more return for everyone in like all around. So
so much of it is like when you talked about language, when we talk about things from a science-based perspective, I do agree with you that the language is very important. The language is also extremely important when it comes to marketing. And the marketing and the packaging and the business part is why I started Massage Entrepreneurs, because I realized if I couldn't get students to listen to me about bodywork and technique, they needed help with business. And if I could help them with business, things would kind of grow and bubble up, and it didn't cost me anything to give them business advice to try to help them.
Right.
Part of the way I win is just to care more than everybody else.
Exactly. Yeah. Having empathy always wins.
Yeah. Being able to, do videos like this to try to educate not only therapists but the public about bodywork, about, well, what is Rolfing? They don't know. Most consumers barely understand what massage is or what a reboot is, whatever it is I'm doing. So in addition, being able to provide videos where they could work on themselves, you automatically, over time, you become an expert.
For sure.
Social media allows us to be experts because we couldn't figure out how to get our phones to work and press buttons to do an interview.
Yeah, totally.
Yeah.
There was a question from Brenda. I'm trying to remember, just kind of backtracking a little bit. Something about like body reading or something. I'm not sure what that was, but as far as like a client assessment, I don't know if that was the question, but in Rolfing, there's a big thing of like assessing the client and their movements. And classically, there's been kind of like, oh, that doesn't look right. That doesn't look like a good movement, or your posture looks off. But I'm thinking more like looking at their behavior and their psychology, like if they're in pain or discomfort, maybe how are they compensating or working around that pain or like avoiding that pain? Like what kind of patterns have they gotten themselves into based on their pain, and how can we provide a different novel stimulus through actual manual therapy work and through movement and posture education that might bring more ease or more comfort or kind of violate their expectations in a way. Like they think because they've been in pain, they've been guarding, bracing, protecting, like, oh, I can't do that movement anymore because it causes me pain. And it's like, well, you've been fearful of that movement for a while, but it's not a bad movement. It's not like off limits. Providing confidence that they can move that way again.
There's so many pieces. Like I know using the phrase biopsychosocial, seems, ivory tower, science, biopsychosocial. In the end, it's, trying to figure out like working on tissue affects emotions, affects how you interact with people around you. A woman I worked with years ago was in chronic pain, and I was warned by the front desk that she was crazy. You remember that the crazy woman from the chiropractor? This is another one of those crazy people. And I was like, okay, she's crazy. I've been warned by the front desk staff. She comes in to see me. I work with her. We had a great session. And come to find out, she's 40 years old at that time. And when she was 22, she was in a horrible, horrible car accident. Essentially, she's been in chronic pain. Her chronic pain levels are getting to like 7 out of 10 on a pain scale. Every day. All day. It's like, she's not crazy, guys. She's in chronic pain.
Right.
When you're in chronic pain, you're at a 7, the biopsychosocial, the way you interact with people starts to change. Because you do not have room for any extra crap when you're at 7.
Yeah, totally. And it's going to affect every facet of your life.
Yeah, it's like it starts to affect your relationships, your interactions with people, the way you work, like, because you still have to deal with all the daily stressors of getting groceries, going to the job, getting paid, taking care of your mortgage.
Right, yeah. Like when I was in my kind of bout of debilitating pain, like this was before I got into body work. I was doing landscape installation, like hauling huge ass trees around, and doing like rock walls and stuff. And then all of a sudden my back just felt like it went out. So I couldn't return to work. So then I start stressing, like, I don't have a job. Like, how am I going to pay my bills? It just affects everything. And then you're just go into higher levels of stress and fear and anxiety. And then you ruminate about it. So yeah, it just like, it's so multifactorial. And of course it's going to affect people, and you might seem crazy from the outside, but you're just like trying to make meaning of it and trying to find resolution for it and get back to life and find fulfillment and meaning in life.
Yeah. There's so many pieces that I could draw out from clinical experience over the years. And I know that I have a deep resonance for people who have chronic pain because I've dealt with it myself. It's helped me relate to clients in chronic pain. And it's also given me a very wily sense of humor as a coping mechanism, for all of those things. And I think it includes increased empathy for people who are in pain, and like the connection I have with, the communication, where it's not only do I understand that you hurt, I understand the increased pressure in life you feel because your wife doesn't understand that you hurt all the time.
Right. Yeah.
It's hard to talk to somebody who has migraines, 3 times a week that are debilitating, when other people just don't understand. They're like, well, you look fine. There's nothing wrong with you, right?
Right. Yeah, totally. And I think asking better questions to our clients can be more helpful too. Like, someone comes in, they're like, I have low back pain. And then we just like stop there and they're like, all right, we'll try to help you with your low back pain. But it's like, what is that stopping you from doing? What can't you do because of that low back pain? It's like, I can't move as well. And it's like, well, why is that important to you? And it's like, well, I'm a father and I want to get on the floor and interact and play with my kids. And I want to have a good relationship with my kids. Like, that's why it really matters to them. It's not just they have low back pain and it stops there. Like, it runs deeper.
Oh, so many layers.
Yeah.
So many layers. Encouraging movement, encouraging not only therapists but clients to work on themselves in various ways.
For sure.
So like if clients ever ask me like, what sort of exercise should I do? I say, what do you like to do?
Exactly. Yeah. What do you enjoy doing?
It's like, yeah. And a guy's like, well, I don't like running. I'm like, okay, so don't run.
Do it. Yeah.
Like, go do something else, I love to dance. Okay, cool. Well, go dance. That's great. To me, even the exercise part, it's like exercise is different than movement.
Right, totally.
And I almost think the movement is more important than to me, like cardiovascular strength or, weightlifting or the capacity to lift, gains, I guess.
Right, yeah.
But also I address that from a body worker's perspective, where I see lots of people who aren't injured because of mobility. They're injured because they're not moving at all.
Right.
They lay down, sit down, lay down, and go back to bed.
Yeah, we basically have like 3 basic shapes in our culture. Lay down, sit in the car, go to work, sit down, come back, sit down, eat dinner, lay down.
Yeah.
Yeah, it's just getting back to movement. Like, exercise is kind of a supplement because we've outsourced our movement. Like, we don't have to do as much today. We can earn our living just behind a screen now, and we don't have to move as much. So yeah, just getting more dynamic movement throughout the day. And, our environment is a huge thing. Like, a lot of our environments don't foster movement. So I think like changing the environment is really good. We're just surrounded by, flat surfaces and 90-degree corners. And it's like our feet aren't moving and adapting over like variable surfaces anymore. Everything is just rigid and homogeneous now. So it's just like breaking out of that, not only mentally, but physically as well. We're just like trapped in boxes.
You just described America, rigid and homogeneous.
Yeah.
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 So like massage and yoga are my two like disciplines that I kind of mixed and matched and blended. My yoga classes particularly became more soft tissue stuff, using foam rolls, tennis balls, breathing exercises, more embodied awareness and movement. My students absolutely love it, but it doesn't look like any yoga class you've ever been to. And I realized it was like even yoga, just as much as like massage, because of dermoneuromodulating pain science, the philosophy behind it started to break down. It was no longer, Thai massage, right? I also got to the point where the yoga started to break down, and I'm like, wait, why are we doing the pose?
Right.
What's the goal here?
Because a bunch of people said this is how you do yoga.
Yeah, and the thing is, it's like, because it started to change and morph, and it's just been such an interesting dance between these two disciplines that sort of merged and then affected each other and started to break down.
Right.
Because
yeah.
I was looking more at the pain science and saying, no, it's not really. I don't really care if their triangle pose is perfect.
Right.
Like it doesn't. That's not even really what I was working towards. Like the physical yoga was just a tool to help them bring in awareness to their body.
Right. Yeah. And that's exactly
just in the same way that the way that we do as body workers. It's just to bring awareness.
Exactly. Yeah. But we get locked into this rigidity of like, this is how you do warrior pose and it has to look just like this, or like, this is how you release the SCM. You go from this way and use this tool, and yeah.
And in both, they're in the pose and I go, how does it feel?
Exactly. Yeah.
And they're like, whoa, a teacher's never, they're always just like, you have to do it, this way. And I'm like, well, I mean, yeah, we can work towards that, but how does that feel? And they're like, it's a little uncomfortable on my thigh. And I'm like, okay, so what happens if you back off just a little bit? And they're like, oh, that's better. And I'm like, okay, cool, stay there. The quality of awareness that you're fostering. Hollis, if I had to say, I really think it gets to a point where I'm going to use, this is Instagram, this is yoga for you. We're helping people be embodied. I feel like people are so distant. It's like they only live from here up. They don't have a sense that their hand is connected to their chest, that their chest is connected to their ankle. And a lot of what we do as body workers is helping them realize, hey, your foot is important. And we know they're just stuffed in shoes and we make it, take us where we want to go. That sense of, I think, holism and sense of integration, a sense of embodiment, it's the opposite of that reductionism. It's like in the scientific method, reductionism is extremely important. It is extremely important in science to reduce variables. I feel like it makes Tim less than a human for me to break him down in just a bunch of component parts. And if we fix the part, the whole is better.
Yeah.
And the qualities, Hollis, I think it just depends on the person. A lot of the work that I do, if I have a boulder bro come in, he's a CrossFitter, he's throwing tires, my interaction with him from the beginning of the session is different than a 70-year-old woman whose husband died a year ago, whose grandkids live, 2 blocks away. I have a very different interaction with these two clients, even though I'm using, for lack of a better term, like manual therapy. And a lot of that probably deals with what you were saying, Tim, about the biopsychosocial component.
Right.
His goals for this session are to be stronger, faster, and be able to throw tires. Her goal is to live a more comfortable life. And I think we can help them both, while still having pain science, adopting a biopsychosocial, framework to be able to work with them from.
You broke up a little bit there for me. I don't know if it was for everyone viewing, but
who knows?
Yeah. But yeah, and then going back to embodiment is something that I've just been. I mean, Rolfing is very steeped in like somatics and embodiment, and like I've been interested in that. But like past few months lately, I've been like, all right, what does it really truly mean to be embodied? And just really exploring that. I don't know if you have your own definition or ideas of what embodiment means to you.
If somebody held a gun to my head, I'd say I don't know.
Yeah.
In the end, it's how does a person feel?
Right. Yeah.
And the thing is, people have a tendency to recoil from pain, to recoil from discomfort, and they have an attraction to what feels good, what feels pleasurable, what feeds their senses. And I think, it gets very quickly philosophical where I start talking about Buddhism and equanimity and, these polar, opposites, attraction and aversion. The whole thing is, what can we do fundamentally that eases suffering?
Right.
I feel like having science-based bodywork eases suffering. I feel like having movement-based practices that make people social eases suffering. If people like to dance, then dance is good for them.
Totally.
From a biopsychosocial standpoint, our sense of pain, ego, self-awareness, self-esteem comes from getting adequate touch and having good friendships.
Yeah, totally. Yeah, and I've been kind of criticized in the group when I've kind of gone off about pain science. People are like, oh, you want to reduce everything and everything has to be scientific. And it's like, I'm actually pretty broad. Like you said, Buddhism, like I totally vibe with Buddhist philosophies, and I'm really into like Taoist philosophy. And like the more I learn about this stuff, like the less rigid and dogmatic I become, and the more broad. Like I've learned so much about myself through studying this. It's been blowing my mind and completely changing my life, really, because it's made me realize where my biases are, and how my brain thinks. And
but from a debate standpoint, I was a philosophy student. My counselor, by the way, encourages me not to debate online. He does not think it is the path to happiness, but part of the scientific method is forming a hypothesis and being able to be wrong.
Right, yeah.
And that is just as important. That is just as important as discovering what is scientifically correct.
Exactly, right.
Yeah. Being able to question and refine, that process is ongoing. The science that we look at as far as pain science now is probably going to be very different in 30 years in some pretty life-altering ways.
Totally.
Because we are learning more. What I'm not willing to do is just make stuff up.
Right, exactly. Yeah.
And from this class, that's a real challenge for me, because when I teach this class, these students start to get frustrated if I do not give them magic energy lines.
Right, yeah. Yeah.
And I'm like, guys, why do you think? And they're like, well, you put it in the book. And I was like, no. You're interpreting. Listen. Joseph Campbell, the hero with 1,000 faces. Listen, you're mistaking the text as the truth. Like you're reading it like a fundamentalist. No. It's like read and listen to this like it's poetry. Then we have something to work with.
Right. Totally.
Yeah.
Well,
man, it's been a really, really great conversation to like traverse. Like through those landscapes. Why do people in the entrepreneurs group get on you about the pain science? Do they feel like you're questioning their body work?
I think because we're all kind of religious in our own ways. We cling to our biases. And if we get results or outcomes from this certain approach, then we correlate those together. And then so if you question people on that, then you're questioning what they're doing and how they're practicing, and they're religious about it. So you're literally debating their religion. So people feel threatened. It's a threat to them. And I totally get it. I've been there myself too. Like,
yeah. I don't know. I kind of like the friction.
Yeah.
Friction to me is like what polishes the diamond. I need a little bit of friction. I don't like when everybody disagrees with everything I say. Increasingly in the Reboot Insiders Club, the subscription service I have, it's really nice because I get feedback from these 100 therapists, and I can see them looking at what I'm doing and picking up more tools and saying, oh, he's not really teaching us like a specific way of working. He's just trying to make us aware of like a broader landscape of like tools that we can pull from.
Right. Yeah.
And to see that development in their practice where they go, oh, it's like, it's okay to be me.
Yeah, totally.
It's okay to have my background, my perspectives, my preferences. And I'm like, yeah, just, like I can't make you, Tim, be me.
No. Yeah.
And it's not even what your clients want.
Exactly. Right. People seek out our personality, our character, and our approach for very specific reasons. And then also, like, how are we going to learn and grow if we're just in a vacuum and we're just confirming everyone's bias? Like, yeah, myofascial release is the only and best technique. And, we need to be around people that make us question what we're doing. Sure.
And man, that's, again, I like a little bit of the friction. Part of the reason I made the rules in the massage entrepreneurs group as they are, people keep coming in as the group grows. It's just another massage group. They don't really pay any attention. They don't understand the rules of that group are very, very different than other groups. I allow things that other groups would not allow. And the reason I do that is because I'm trying to maintain a degree of transparency and free thinking so that friction can continue within the industry.
Right, yeah. Yeah, it's interesting. Like, I think back, like, years ago, I lived with my brother. He was my roommate, and I was like, oh, this is going to be cool. But then we just got back to our, like, brother relationship, and he would just call me out on my shit over and over and over again. I was like, man, you're being a jerk. Like, I don't like this. But then I realized, and it really helped propel me and grow myself and deepen myself. And I just think that's extremely important.
Yeah. It's an art. What we do as body workers is an art form, and it's something that has to be constantly refined and developed. I'm very much in that mindset of, like I said, Picasso. It's like, yeah, people are going to look at the whole scope of your art over the years, but what people won't do is the hard work. And the hard work is getting up every day with the easel and painting.
Right, yeah.
And refining and working at it again and again and again. Also, I think one of the larger challenges with our industry is the turnover rate for massage therapists is so high.
For sure.
That, therapists, if they only last 3 to 5 years, they don't ever get a chance to develop what I think of as mastery.
Right, yeah. Another too is a lot of massage therapists don't necessarily get into this work because they're scientific minded. What I've seen, like, in franchise work at certain places is, like, people just think it's, like, going to be a cool, chill job. Like, oh yeah, I can just show up and just, like, be in this, like, dark setting with chill music, and that's their whole idea of what it's going to be. And then they run into situations where people really want help, like they're in pain or they're in discomfort, and then, like, they're like, oh, this isn't a cool, chill job anymore.
Yeah. Create your environment. I'm a big proponent of, like, we have arguments in the entrepreneurs group, and it gets to, like, massage envy and corporations and large chains. I'm like, guys, listen, I work out of my garage.
Yeah.
Figure it out. Like, rent space, create the next thing.
Totally.
If you're into pain science and biopsychosocial issues in the massage industry, like, make that your marketing niche and push that forward and create the next massage envy, the next thing, whatever that is. Like, I'm for diversity in the bodywork marketplace, and I think there's plenty of room for specialization.
For sure.
Yeah. Well, listen, I think I've about reached the end of my rope.
Cool. Yeah.
I think I'm going to head out and take a walk so I can get out and move around.
Sounds good.
If you want to do this sometime again soon, just let me know. Like if you get feedback from this and you have specific issues you want to discuss,
For sure.
I'm really happy to do that. After this, I'll go ahead and share this in the Massage Entrepreneurs group, or you can if you'd like.
Cool. Sounds great. I really appreciate it. Thank you so much. And thank you for your patience with me getting this set up and all the technical issues.
Oh, sure. Yeah.
I really appreciate it.
Always happy to. So yeah, I'll chat with you just a little bit when we get off. I'll go ahead and tell people. Before we forget, where can people find you? Do you have like a website somewhere you can send them your social media?
Yeah, I'm at tim-norton.com. So that's tim-norton.com.
Okay.
And then I'm on Instagram, Inherent Vitality. It's kind of a philosophical name, but yeah.
Okay. Cool. Just to make sure they can find you.
Right.
But yeah, I'll go ahead and chat with you whenever we shut this down. If you are watching this and you have other questions, feel free to just write down below. Tim or I'd be happy to chat with you and go into further conversation about that.
For sure.
But thank you so much for talking with me today, and I'm glad we had to have a chance to be able to talk.
Me too. It was awesome. Thank you.
Cool. You're welcome. I'll talk to you soon.
All right. Later.
Bye.